Hi everyone, and welcome back to the series Just What Can a GP Do? In this episode we'll be talking to Dr. Payal Patel, who is a GP with a specialist interest in dermatology. She talks us through her career and also provides us with some useful tips and advice. As always, if you like the video then make sure you give it a thumbs up. And if you haven't subscribed, then why not consider subscribing to stay in the loop of series just like these, and I'm sure you'll find some useful content on my channel that suits your needs. Also, if you're going to subscribe, then don't forget to turn the notification bell on so you don't miss out on new videos.
Hi guys, I'm Dr. Patel and I'm a GP with a special interest in dermatology, and I work in a busy suburban practice in Surrey, and I'm really excited to talk to you about how I got to do what I'm doing now and what it means to me. So I qualified as a GP back in 2012, and I started working as a salaried GP soon after. I did that continuously for about 2 or 3 years. I've had 2 kids, so you can imagine the time frame. And about 3 or 4 years into my GP career, I decided that I wanted to do something more. I always had a special interest in minor surgery, and I'd done the minor surgery course. So I decided that I want to do something related to skin. And I discovered that there's a diploma that you can do that allows you to increase your knowledge in dermatology. As we all know, GPs deal with a lot of dermatology, and I thought, great, this is a great opportunity to try and improve my skills and also bring in some special skill set into my practice. So the diploma that I did is a 2-year diploma. I did it at Cardiff University. It costs anywhere between £9,000 to £10,000 for the 2 years. It's part-time, so 10 to 15 hours of work a week. There are exams, there are tests, and there are lots of written assignments to do, but it is really, really interesting. And that's what kept me going in those 2 years. Alongside that, I was lucky enough to have loads of support. So I did a job as well. So I did a fairly full-time job. So it is doable. And I have the 2 young kids. So you can imagine it is tricky, but if I can do it, I think most people can do it. So where does that leave me? So once I did the diploma, I decided, well, actually, I have all this knowledge. How do we use it to benefit the NHS, the PCN? Now, what we know is the PCNs. So I discussed it with the CCG, and I sort of said, well, perhaps I can use my skills to help patients who are being referred to see the dermatologist at the hospital. We set up this system, which is called a dermatology step-up clinic, whereby I vet every referral that goes through to secondary care. And it became really, really interesting actually to see how much I could reduce referrals to secondary care, and not just reduce referrals, but also reduce wait time for patients by trying to do something in the interim period. So, patients, for example, patients with eczema, patients with psoriasis, there's lots of steps that I could perhaps do using my knowledge that I picked up in doing the diploma. So that's been really invaluable to my practice. So I actually am employed by the PCN at the moment to do dermatology for them, and that's for about 35,000 patients. So it's really interesting, it's really rewarding, and patients love it because they get this extra service within the community. They don't have to go to the hospital sometimes because I vetted the referral. So aside from dermatology, I also do a little bit of minor ops, and that includes doing shave excisions, doing a bit of cryotherapy, joint injections, and it all ties in really nicely with the patients that are coming in to see me for the dermatology. There's a lot of continuity of care. They know that the Dr. Patel dealing with the skin is dealing with their wart or verruca or whatever else. So it's really nice for patients. The other positive is that I work 8 sessions, so it can get really exhausting doing 8 sessions of general practice. What you want to do is get as much variety into those 8 sessions as you possibly can. Some people do teaching. I like teaching, but it's not something I've gotten involved with. So, this takes out 2 sessions. So I do 6 sessions general practice and 2 sessions PCN work. The disadvantages can be that there isn't a lot of extra work. So patients often, say, well, Dr. Patel saw me last time. Can I just see her in the normal clinic? Can I just ask her a question? There are some downsides to it, but on the whole, it works really, really well. How much do I get paid? And does it bring in good money? That really depends on how you negotiate with your particular CCG and PCN. And this is where having a little bit of business knowledge can come in really, really handy. I'm not great with numbers, so I just go by whatever my practice has negotiated with them, which is better than working in a hospital as a GP with special interest. There are two different pricings, if you like. One is someone like me who is working in the community or their PCN, and then there's the doctors who are working under the dermatology department in the hospital, who are kind of under the wing of a dermatologist. So that is less risky and probably more supported in the hospital. So you've got to bear that in mind. So the hospital GPSIs, in my view, get paid less than the community GPSIs. Now, the community GPSIs get paid anything between £70 to £90 an hour. And the hospital GPSIs can get paid anything from £200 to £350 per session. So that's half a day of work. Again, that can vary. London varies. I've got lots of friends outside of London who work as GPSIs and get paid much less. So it depends on where you are. The other question I get asked is, can you do it as a partner? Can you do it as a salaried? That doesn't really matter. It doesn't really come into it. I'm a salaried GP. You can do it as a partner. You can do it as a standalone job as well. So you can do it as what we call a portfolio GP. So you don't need to be tied in with a practice. I personally think doing a dermatology special interest job, you should be part of a practice. It gives you that broader perspective of general practice, which is really, really nice. As those patients are being fed into your clinic, and those patients go back into your general practice, which is really, really nice. Another positive. How many patients do I see? I get asked, how many patients do I see in a dermatology clinic? Now, my clinic is a unique setup, so I see anywhere between 15 to 30 patients in the 2 sessions. Sometimes it can be 32 patients in the day. They're about 15-minute appointments, and I cram it in because I want to get home around about 6 o'clock. People can spread it out, and it depends. I mean, hospital clinics I don't think are any different really. They're about the same time frames, and it depends. I mean, hospital clinics I don't think are any different really. They're about the same. The other thing to mention as well is that you should have support. So your local dermatology department should support you in this, because technically if you want to become a GPSI in any field, you need something called accreditation from the RCGP. So you would need to discuss that with the RCGP. There's a bit of paperwork with that, which is really, really, really important to get out of the way. It's a long process, but I don't regret it one bit, because I love that I've got something else in my tool belt that takes me away from what we all see as normal general practice. And general practice doesn't have to be boring, it doesn't have to be mundane. There are so many things that you can do to keep things interested for you as a GP. So my top tips for getting into general practice would be, think about it. A few good conversations with people who are in the business. Have a chat with partners, have a chat with salaried GPs, have a chat with GPs with special interests. Watch videos like this to help you decide, because there's not many out there, but Patrice is doing a great job. I would look at the bigger picture. Don't just look at pay or how long it takes to train as a GPSI. I would look at what you want to get out of your career, because for me it's about longevity. I want to keep myself interested in what I do, so this is my way of keeping myself interested. And the thing about learning is that it never really stops. Even as a general practitioner, you're always going to be learning new things, new methods. That is my first general piece of advice. In your GP placements, once you're in general practice, try and sit in with as many people as you could possibly sit in with. And that includes anybody that's coming into the practice. So whether that's a midwife or the district nurses, or any specialist interest people like dermatologists, or, these days the PCNs are doing all sorts of stuff. So it's really nice to get your foot into lots of different, or get your finger in lots of different pies, and speak with them and say, where is this going, and how could you tie primary care and secondary care together, because that's where the future is. That's where you want to be. You want to be in the middle, bridging that gap. That's my biggest advice, is think about the future. Don't think about don't think about what's going to happen in a year or two. But yeah, that's it. And keep asking, and keep sitting in with people, bottom line.
Well, I hope you enjoyed the video and learnt loads. If you found the video useful, then give it a thumbs up, and I will see you in the next episode.